To this month's video tip on how to take the stress out of discharging dental patients at your veterinary hospital. This is Wendy Myers with Communication Solutions for Veterinarians in Denver, Colorado, and we help practice teams improve communication skills, compliance, and client service. We offer monthly continuing education credit webinars, and you can find out our schedule and topics on our website at CSVets.com. Communication Solutions for Veterinarians is one of the largest phone skills training providers in both the U.S. and in Canada. We've trained nearly 5,000 hospital teams. So I want you to imagine that you're a veterinary technician at an animal hospital, and today you've had a very busy day. You're the dental technician and you've completed 5 procedures on pets. Well, this afternoon, just 30 minutes before the hospital closes at 5:30, at 5 p.m., all 5 clients arrived to pick up their pets. The unfortunate part is that not only are you going to be stressed, but also are your waiting clients. You know, these are 5 people whose pets have been under anesthesia today. They're already anxious, and now they're waiting 20 or 30 minutes to talk to a member of the medical team to find out how their pet did and have that reunion. Not only are there waiting delays, but you have to scramble and are very frustrated because you're trying to print out and make final updates to home care instructions, and you're also rushing to the pharmacy to fill any antibiotics or pain medication to go home. The result, besides you being incredibly stressed, is that clients are also going to experience a poor level of service. Instead of stress for everyone involved, create a plan for your success. I recommend that you set the discharge time during the admission. You know, at an animal hospital, we typically admit patients between 7 and 8 in the morning for surgical or dental procedures. And during that time, I want you to actually schedule the time that they're going to pick up their pet and have that discharge appointment. This gives you a deadline because you know exactly what time the client's going to arrive, and make sure you've prepared all of those home care instructions, that you have the x-rays ready to show them, and also any medications filled. This is going to be stress-free for both you and clients. Now, that morning, I recommend that you always admit patients in the privacy of an exam room. You know, at 7 to 8 o'clock in the morning, the front desk is simply chaos. There's ringing phones, there's clients arriving for morning appointments and admissions, and it is just too much distraction to have a thoughtful conversation, especially when we're discussing something as serious as a pet's anesthetic procedure. In the privacy of an exam room, the technician can fully answer all of the client's questions about both the treatment as well as the cost of care. You also can have the client sign the treatment plan, and that gives you not only legal permission to treat, but also that they understand the fees and will pay you at the time of release. You're going to discuss communication expectations with the client and explain what will happen the day of the procedure. And then lastly, you're going to set the discharge time. So I created a script for you of how to set expectations with the client during the admission appointment. You're going to explain that you'll call after 1 o'clock once the pet is fully recovered from the procedure. And this way the client doesn't anxiously call you at 11 in the morning and see, oh, how are they doing? Because of course they were admitted at 7 and they probably assume their pet is going first. Now, do let the client know if she's concerned that she can call you anytime, and provide a business card. I like to provide a business card because not only does it personalize the visit and the client knows personally who is caring for their pet, but should the client call, they know who to specifically ask for. And this will allow the receptionist to quickly connect the call. You can also watch our video on our YouTube channel about the importance of using business cards in your veterinary clinic. During the admission, you're going to set the discharge appointment, and I do want you to call it an appointment. It is a set time, and explain to the client what to expect for that discharge appointment. Explain that you're going to share the results of the procedure, show them the dental x-rays, and then discuss any medication instructions as well as home care. Then you're going to use the 2 yes options technique to present 2 discharge times that you have available in your afternoon schedule for the client to pick up their pet, and then have that thoughtful discussion. So you can explain to the client, we can see you either at 4:45 or 5:15, and this is for a 15-minute appointment. So they know also how much time to plan in their schedule. And then ask them, which do you prefer? Now, you also will want to decide the morning of admission who is going to discharge the patient. and decide whether that's going to be a veterinarian or a technician. And I'll give you an example because I do feel that your technicians can discharge the majority of dental patients. But let's say that we had a grade 4 dental patient that perhaps it was a cat with full mouth extractions. Very intensive work. There's going to be a lot of client questions about home care and about pain management and about what kind of diet their pet needs to now eat with no teeth. I probably would have the veterinarian do that dental discharge and explain in detail that information, and you may need more than 15 minutes to do that as well. If it is a more routine case, you could have the technician discharge that. And if it's a doctor, you're going to put that in their afternoon appointment schedule. If it is a technician, you're going to put it in the technician column so that the technicians know what time clients will be arriving, and you do need to designate which technician is going to do that release. Now, when you create a plan for stress-free dental discharges, it's going to not only help you, but you're also setting yourself up for future procedures. You know, dentistry is something that pets are going to need multiple times throughout their life. And if the client has a poor discharge experience today, it's going to be more difficult to persuade her to do a dental procedure in the future. So make sure that you have a great client experience from start to finish. Thank you for watching this month's video tip on how to improve the discharge experience for your dental patients. You can get additional information about our services and our training programs on our website at csvets.com.